some periods of a break of it not being so bad, but then you're hit with it again.
Trying to crack me, I'm an activist for
Or having the time of our lives.
Yeah, I want to keep doing it.
There's different phrases of CVS. The problem phrase. The first phrase, the person feels that an episode is going to start with the nausea and the vomiting is about to begin. This oftenly will start with, your heart racing, feeling nauseous, your stomach feels bloated, you could be sweating, the nausea is so bad, you can have abdominal pain that has you hunched over. A person can appear pale, but also they could be red, because a lot of us have mast cell activation disorder that have CVS as well. These are all comorbid conditions that go together. So Hyperemesis Gravidarum, Cyclic Vomiting Syndrome, mast cell activation disorder, and dysautonomia, just like EDS, Anlos-Danlos syndrome. These fibromyalgia, they're all in this little same type of category. If you have one, you're more prone to have the other. The problem phrase can last for a few minutes or a few hours. It's where I call it your golden window of opportunity. Your golden window of opportunity is a short period of time where you have a chance to abort your episode and get your meds in you in the golden window of time. You're going to be sick and you're not going to be able to stop it no matter what. It just has to run its course, and it's horrible. I've had attacks, vomited 100 hours straight nonstop, 98 hours straight nonstop. It's horrible, and I wouldn't wish it on anybody. I was treated like shit when I had hyperemesis, when I was pregnant. And the care that I received and the way I was treated, you would think that L&D nurses and the doctors would be really nice. You're having a baby. In my experience, they were awful to me. Awful. I got treated so badly and so bullied and so alone. And only my mama and my husband were my understanding points. The second phrase is the vomiting phrase, which is intense nausea and vomiting and belching and pain. Periods of vomiting and belching can last 20 to 30 minutes at a time or longer. For myself, when it was bad, it was just nonstop. I couldn't speak, I couldn't move. All I could do was lay there with my face in the bucket. So, I literally lay like this. They have mixing bowls that have like a indent here for your chin. This is the way I have to sleep when I'm sick like that. I have to have my face in the bucket, or it's just, I'm not comfortable. So the person can be unresponsive because they're in a conscious coma. The abdominal pain can last for days. It can last for hours. If they're vomiting a lot, they need to go to the ER for hydration. It's very important because dehydration can kill you. I've had people in the CVS community that I know that have been in comas. I've been in life support because CVS can kill you, just like Hyperemesis Gravidarum can kill you. The recovery phrase is when the vomiting, the belching, and the nausea subsides. Improvement of the symptoms during the recovery phrase can vary. Your health recover, your energy, but you want to take it very slowly. You just don't want to go back to chugging and eating, or you're going to get sick again. Your episodes usually are the same in length and in time. Sometimes with people it's different, but that's like the most common way. I don't like to say textbook because none of us are textbook in any way, shape, or form. Everybody has different triggers with their CVS. And your CVS can wax and wane, just like hyperemesis can. We're all different, but it's important to know what CVS is. It's important to know the phrases of it. It's important to know what medications and what treatments are out there for you. And you're not going to learn this from any doctor. You will learn this from patients like me. Your mitochondrials are cells in your body that convert food to energy. You need this in order to survive. This is how HG comes in. The factor of Hyperemesis Gravidarum and CVS are actually related by a DNA mutation called the RYR2 factor. You are your best advocate. Nobody else can do it for you but you. You have to remember that, to be your own advocate. Is it scary to challenge authority? Absolutely. Is it going to get your adrenaline and your heart racing? Yes. But you have to do it. You have to advocate for yourself. I cannot stress this enough. Otherwise, they're going to kill you. They have a free license to kill you and get away with it. Different spectrums of CVS, and everybody suffers it differently. Be in a constant cycle with CVS that just won't relent up. CVSers will experience symptom-free periods lasting for a few days, weeks, or even months, depending on the CVS sufferer. We all suffer differently. Just like our meds that help us for CVS, everybody's different. Just like our DNA, like our fingerprints, nobody's the same. So you have to remember that. Everybody is different. So everybody has different triggers with their CVS. And your CVS can wax and wane, just like hyperemesis can. And not having that validation is hard. Complications of CVS: you must replace fluids when they're lost because vomiting and diarrhea. When you're dehydrated, the body lacks enough fluid, electrolytes, then it unbalances with your sodium, your potassium, your magnesium, and you need these things to function in life for your body. You can also get tears, Mallory-West syndrome, in your esophagus, Mallory-West tears, and you could vomit blood. And I had to go in and get, them clipped off with these metal clips to stop the vomiting in the past. But it can irritate your esophagus really bad. Tooth decay is common. Your teeth, your enamel is damaged from all the vomiting. All my teeth rotted from having HG and then still having CVS. I have dentures, so I have on the bottom titanium screw to pop my teeth in. $5,000 for each one. To glue it here, but they snap in. And then these ones I actually glue in. And have more teeth videos and learn about dentures and the whole process, just let me know in the comments and I'll make those videos. I don't mind showing you what I look like with my teeth out. I don't mind answering questions about dentures and repairing your mouth and showing you what I look like with no teeth and answering those common questions, because I know back then I had questions like, can you take your teeth out when you're vomiting? Like, these are things when you don't have dentures, you just don't know. That's the only good thing. I could take my teeth out. However, you can see your face and your bone structure when you lose it. This is what happens. So see all this excess baggage skin? This is from losing my bone structure. Your face should be like this. And even though I'm older and I've lost so much weight from malnutrition and everything, it's just, I can't fix this. See all the wrinkles, everything. So I look so much older because of having to have my teeth out. But at least I could take them out when I'm vomiting so I don't ruin them. And you don't want to ruin them because dentures are your lifeline. This is like my 6th pair. I need to get another pair because these are, I've had these for a while. But I've also had a stroke, so see, like you can tell my smile's crooked.
Make sure to follow me, like my video, and share it. And remember, sharing is caring. Make sure to follow me on my verified Facebook page. Look for the blue check mark. Subscribe to my YouTube and TikTok. And I'll see you in the next video.